All right. Today I'm joined by Dr. Mona Mislankar, and she'll be talking to us about dermatology. Hi, Mona.
Hi, Con. Thanks so much for having me. I think this is a great service that you're doing for medical students, especially, this year where everyone's not able to kind of get out and maybe shadow and learn about the different specialties, that they would in a normal year. So I think this is great. And thanks for having me.
Yeah, I definitely appreciate your time. Dr. Mislankar and I went way, way back in med school. I think we were co-presidents of pediatrics.
Yes, which I was going to get to that later when you asked me about other specialties I was considering.
Yeah. I think both of us were considering pediatric, and hopefully she'll share her stories. Just give us a brief description of your path, and then also the job description of dermatology.
Yeah, so I did my 4 years of undergrad at Ohio State here in Columbus, Ohio. And after that, I went to medical school at the University of Cincinnati with you and some of the other colleagues that I know you've had on the YouTube channel. So after medical school, dermatology is a 4-year residency. You do have to do a 1-year internship. Most of us residents either did a transitional year or a preliminary year in internal medicine, but it could be in internal, it could be in surgery. I did my prelim internal medicine year at Case Western up in Cleveland, and then I matched dermatology down in Florida, which was fantastic, at the University of Florida in Gainesville. So that was an additional 3 years. During those 3 years of dermatology, we do a little bit of everything. So we do adult dermatology, we do pediatric dermatology, surgical dermatology as part of our 3-year training. We rotate and do a lot of days on the Mohs micrographic surgery. We do hospital consults, dermatopathology. So it's all encompassed in 3 years. So I did that. And then after I graduated, I came back here to Ohio. I'm currently in Mason, Ohio, which is basically a suburb of Cincinnati. That's where our family was. And right now I am working in private practice. So it's a solo private practice. It's, owned by a group that has multiple other private practices. I'm the only physician there. And then I work with 2 nurse practitioners. So there's 3 of us that are providing care here in Mason, Ohio.
Awesome. Thank you for that description. So thinking back to your medical school years, did you always want to do dermatology? I know you were president of a pediatric club. Can you go through with us the thought process and how you
Yeah,
came up with dermatology?
I didn't realize I wanted to do dermatology until I would say the beginning of probably 3rd year.
Hmm.
I know some say that they knew that they wanted to do dermatology the whole time. I know some that didn't actually even figure it out until like very end of 3rd year. But for me, I definitely my whole life thought I wanted to do pediatrics. Even when I went into dermatology residency, I sat down with my program director and said, "Hey, I want to do pediatric dermatology." So I was really, really pretty sure that I wanted to do pediatrics. So what I did was in medical school, at UC, we had the option of trying to figure out how we wanted our 3rd year schedule to lay out. So I decided I would do pediatrics in the middle so that I would have 6 months of, kind of knowing how to act as a good med student and really impress the pediatric team. So I got what I wanted, and pediatrics was in January. So I
Hmm.
started with surgery on my first month. And I loved surgery. I did not think that I would, but I absolutely loved it, which got me thinking that, maybe I wanted to pursue a surgical specialty, but still I wasn't dead set on that. I realized that I loved surgery, but I, didn't necessarily love the lifestyle for kind of what I envisioned for my future. And I didn't really think I wanted to be in the OR. Then my next elective was dermatology. So I had 2 weeks of dermatology and loved it. Loved
Hmm.
the people, loved the cases, loved the ability of being able to see pediatric patients to 100-year-olds. But again, I liked it. I didn't really think too much of it at the same time. I started to talk to some of the residents there, the program directors, start getting into research, just in case I wanted to go that way. But I was still pretty sure I wanted to do peds. And then, my peds rotation came along and I loved peds. It was great, but I realized that I really enjoyed dermatology the most. So I would definitely say it wasn't something that I ever thought I would get into going into medical school, but it was a good time when I figured it out, because third year is really when you want to start, lining up some of those opportunities. I don't think it's too late if you figure it out after, but it was a good time when I figured it out.
Awesome, thank you. And I think most of us realize dermatology is a very super competitive field. What do you need to get into a dermatology residency?
Yeah, dermatology is very difficult, because I think it's definitely, a lot of people want to go into it. And, a lot of it requires, I think, research. I did a lot starting off third year. I had some research before that. Between my first year and second year of medical school, I did some basic science research. It was actually in pediatric cardiology. But still, I think having research is really, really helpful. And from what I hear about medical school in general right now, I think everything is getting pretty, everything's getting pretty difficult. So research is probably good for anyone to have. Um, the big thing is, I really think you need to just make yourself, you have to stand out somehow. And
Mhm.
whether that is research or whether that's just something that you're doing on the side, all of us in medical school are, hardworking, we're driven. On paper, a lot of us look the same. So you really need to have something that makes you stand out. I am lucky that I got in the way that I wanted, and I was able to match into a great program that was such a good fit for me. But looking back on it, it's easy to say that I wouldn't really change anything, because it luckily worked out for me the way that it
Yeah.
did. But if I really truly had to give someone advice, I would say that if you really, really are interested in dermatology day one, and you don't necessarily know if you have the time to get some of that research and stuff done during your first 2 years, because they are hard. Basic science is hard. There's not a whole lot of extra time. I would highly consider maybe even doing like a gap year between second and third year and trying to do some research. And if not, just finding other opportunities for it. I did not do that. But had I think it would have made my process on applying a little easier. And I don't think I would have looked at it as a waste of time at all, because I think it would have just probably added to everything that I do on a day-to-day basis.
Awesome. Thank you for that. And that, what personal qualities do you think make a successful dermatologist?
So, everyone in their practice is different. Some of us see a lot of patients, some of us don't. But overall, I would say it's very fast paced. It is
Mm.
in general, most of us are outpatient, and so it's very, very fast paced. So I think you definitely have to be a people person.
Yeah.
I mean, I see 40 patients a day, so I am in and out of rooms. I'm doing a lot of my procedures, a lot of my examination while I'm talking to the patient, while I'm talking to their families in the corner. So I think my patients, I think appreciate that I can be real with them. I'm talking to them. We're having discussions about like what they're doing on vacation while I'm still examining them. So I
Mhm.
definitely think with a lot of fields in medicine, though, definitely need to be a people person. It's very, very visual. So one of the best things I love about dermatology is that from the dermatopathology to the clinical things that I see on examination, color is important, feel is important. So you definitely have to be a visual learner. I've always been like that. Even with med school, I was the girl that was highlighting and writing notes, and I could picture where stuff was on my, my books when I studied. So being visual, I think, is important. And you have to be good with your hands. Like, not every specialty in medicine is very surgical.
Mhm.
Dermatology doesn't have to be surgical. In residency, it does need to be. You need to be able to, to be able to graduate, you need to excel at all of those aspects. I have some colleagues that don't necessarily do surgery on a day to day, but for me, I'm doing cosmetics, I'm doing excisions, I'm doing procedures all day. So being able to, be steady, work with my hands, that was that's a big part of it for me too, I think.
All right. Awesome. And then how do you find the most exciting part of dermatology?
I love the variety of it.
Hmm.
It really helps me from not to like get bored on a day to day. So basically, again, all dermatologists, some of us subspecialize and only do that specialty. Some of us, choose to only do the medical dermatology part of it. But the best thing is that because of that 3-year training, we are experts in all of those subcategories. And so we're trained when we get out of residency to be able to pursue them if we choose to. So for me, I do a variety of medical, surgical, and cosmetic dermatology. So I just love the diversity of that. Like in a day to day, in 1 hour, I can go from looking at a kiddo with, atopic dermatitis or eczema. And then I'm walking into an 85-year-old skin check who's had like 3 melanomas recently. I'm going into a Botox patient. I'm lasering a scar. And then I'm going straight into like a melanoma excision. So I like that there's so much variety in it. Um, we're always learning. Just anything can look different on so many patients. So even when you think you've seen it all, you know it all, I can get a rash that just looks so entirely different than it did on maybe a different patient a couple months ago. And so I just feel like it keeps me on my toes. I like the fast paced nature of at least how I'm set up, so it really makes the workday go by. And I love the continuity of care. So I definitely, again, really thought I was going to do pediatrics. So I love that this lets me still see kids. I see all kids from newborns to, the time that they go to college. But then I'm also able to see their siblings and their
Hmm.
parents and their grandparents, and entire families come to me. And I love that. I was just talking to one of my patients, my melanoma patients last week, and he was telling me about how his granddaughter got into a nursing program and she's my patient, so I really appreciate the continuity of care there.
Awesome. Thank you. And then on the other end of the spectrum, what do you find the most frustrating or aspect of dermatology?
Oh, so overall, I'm biased. I love dermatology. I don't
Yeah.
think I would ever
Yeah.
change anything if I could go back.
Yeah.
But and I don't know how specific this is necessarily to just dermatology, but one of the biggest things I think for a lot of us right now is access to care.
Hmm.
It is very it's hard to get into a dermatologist. We are busy, and I know a lot of my patients get frustrated that there's such a long wait to come in and see us. So we're trying to improve that, and I think things like telederm is helping that this year especially. But that's hard. I get it's frustrating when patients feel like they've waited a couple months to show you what's going on. Insurance is a battle every day, and I know that's not something specific to dermatology, but there are a lot of treatments, especially in dermatology, that are not necessarily FDA approved treatments, but we use medications off label.
Hmm.
We are treating more than just acne and pimples, and we're doing hardcore systemic medications like Cellcept and Imuran, rituximab, but a lot of those are not necessarily FDA approved for some of these conditions. So we fight a lot with insurance and prior authorization. So that's been difficult. And then time, I think I would love in a normal situation to have so much time with my patients. And I could, I could definitely tailor my practice and see less patients a day, work more days of the week, of course, to be
Yeah.
able to do that. So everyone's going to have their own situation. With my schedule, I like to be able to get my patients in. I don't want them to have to wait 3 months to have to see me. So, we have a lot of urgent add-ons. But that makes my day pretty crammed. And so that means that I am going quickly from room to room. And I, don't ever want my patients to feel like they're being rushed or I'm not hearing them out. So in a given world, I would love to have more time with the patient to just really sit down and talk to them. And I think from talking to most of my colleagues, most of my dermatologists, we do really feel like time is not as much as we would want. So I would love that. But
Yeah.
overall, I love it. And hard for me to find many reasons why I don't.
Yeah, yeah. I appreciate those answers because I think students should need to know those answers so that way they can somewhat adjust their
Yeah.
expectations. And I mean, uh, I chose you because I thought you love what you do and hopefully show students the aspects of dermatology. And I think dermatologists in general are more they essentially love what they do for the
They
most part.
do, yeah. When
So,
you look at all the surveys of, I don't know the exact percentage, but the Medscape articles that we get, like, would
mhm,
you choose dermatology again? I think again, I don't know the percentage, but everyone I know would do it again. I would not change a single thing about what I do. Like what I can't think of another career that I would love
Yeah.
daily.
Yeah, it's very high up there. I think
Yeah.
either one or two.
Yep.
I
Yep.
think my profession is kind of low on the lower side.
Probably. A lot of
But
burnout. There's not a lot of burnout in dermatology, so that's great.
yeah, awesome. So you talked about the day-to-day aspect.
Mhm.
How has this shaped your work-life balance?
Work-life balance is definitely dermatology is one of the specialties where it is definitely easier to have a good work-life balance. We choose, of course, I can choose how many days I work. I can choose what my days off are, how many hours I want to work. But being mainly outpatient, in residency, we did a lot of inpatient consults, but I don't anymore. So I'm entirely outpatient. So that definitely makes it a little easier to have a good work-life balance. There are things that we see in residency when we're inpatient, like Stevens-Johnson syndrome, et cetera. But overall, when we're looking at specialties and emergencies, the majority of what we do in dermatology is outpatient. So that definitely helps me have a good work-life balance. I was always a night owl in medical school. I liked the night shifts, but in dermatology, those don't exist. We
Yeah.
have pretty good normal hours. I work 8 to 5. I don't personally take a lunch break, maybe like 20, 30 minutes, but that's mainly because I am just, getting back to my patients. That's my time to do my pathology results, get back to my messages, look at prescription insurance things. But that gets me, a normal work day. So 8 to 5, cannot complain about that. Again, everyone's different. I choose to work 4 days a week. That just works for me and my lifestyle and my new kiddo. But overall, work-life balance is definitely really, really ideal in dermatology, I would say. So that was a big factor for me picking
All right,
medical
awesome.
practice.
I know you work primarily not academic. I know you primarily work private practice. Can you share with us the main differences between academics or private, if you have
Yeah.
thoughts on
So,
that?
our residency was obviously most residencies are all academic.
Mhm.
But being in dermatology, we were able to have our outpatient clinic and then we had our inpatient hospital that was kind of separate. So it was easy to kind of see both. Um, Academics, you're doing a lot of work with residents, with med students, a lot more collaboration with the hospitals.
Mhm.
Private practice, it's really just my staff, me, and my 2 nurse practitioners. So every once in a while, I will get, a message from a pre-med student or a med student who wants to shadow. And so we'll let them shadow. And it's just fun to kind of see that again and kind of get back into the teaching. I really enjoyed, when I was chief resident, I was, in charge of kind of lectures and teaching, and we did a lot of lectures to medical students, PA students. So I do miss that aspect. There's not a whole lot of it in my private practice, but I know other private practice dermatologists that do routinely have shadowers. So, there's definitely opportunity to do that. In private practice, we're not there's opportunities again for me to do journal club and to do research, but I would definitely have to kind of go out of my way a little bit to find those things, whereas I think in academic medicine they're a little bit more built into your schedule. Research was not one of my like top priorities in terms of what I wanted to do with my career. I think there's a place for it. I think it's incredibly important, but it
Mhm.
wasn't one of the things that I necessarily needed, to
Mhm.
fulfill kind of my day to day in dermatology. But if you're private practice, and again, there's room for research, but if that's something that's important to you, having an academic position or being affiliated with a hospital is probably definitely um, a little easier to kind of get those things done.
Awesome, thank you. You brought up telemedicine and more or less recent changes, COVID. Can you briefly discuss more about that, and also what do you see in the future of dermatology?
Yeah, so I definitely think in light of COVID, most specialties have had to kind of figure out how they were going to do telemedicine. Before all of this, I had actually last year spoken with a couple groups through my work itself to see if telederm was something that I would be interested in doing.
Mhm.
Um, And I realized how hard it is in dermatology to do telemedicine. There's definitely refill requests, stable acne patients, stable eczema patients. There, it's great. I think that COVID has definitely brought it into light that a lot of patients prefer having those options. It's we're all busy, we're all working. It makes it a lot easier to be able to hop onto your computer rather than take the time out of your day, go sit in a waiting room and see a physician. So I think it's here to stay. I really do. I hope that there's been a lot of back and forth with insurance on how long they're going to continue to cover these services. So I guess we'll all have to kind of see how that goes. But I do think it's here to stay in all of medicine. I think it makes medicine easier, but it also taught me how I definitely could never do an entirely telemedicine practice, because so much of what I see I need to feel.
Mhm.
Not even talking about the procedures that I do, but just the lesion checks. I can't do skin checks obviously over telederm, but just even being able to spot check a spot, I really need to feel it. I need to see it in person with my dermatoscope. So I was kind of personally shocked that I didn't enjoy it as much
Yeah.
as I thought I would.
Mhm.
I really thought that in the future, maybe I would cut down my time in the office and do more telederm. So I definitely will not be doing that. But I do think it's here to stay. A lot of my Accutane kiddos that are off at college, it's made a lot of those kind of visits a lot easier. So I definitely see us keeping it. I hope insurance will allow us to kind of keep it forever, because there's definitely a good market for it. But yeah, I definitely prefer my face-to-face patients.
Yeah. And then the other aspect, do you see what changes do you see in down 10 to 20 years with dermatology?
So I think the big thing that is really on the talk right now is, so a lot of again, I don't own my own private practice, but a lot of my, I know colleagues that do, and it's getting difficult because a lot of these, hospital practices, PE groups are buying out smaller private practices. I think the new talk is that a lot of these insurance companies are going to start out buying, hospital groups. So I think it's getting harder and harder to own your own private practice, which is a big part of dermatology.
Mhm.
So I'm seeing a lot of my colleagues go over to like direct cash pay practices. As someone who has insurance, we all, I think, are learning that with insurance, our deductibles are getting higher and higher as our, years go by. And so I see a lot of patients who, one, unfortunately, don't understand why a lot of the stuff that, they want done isn't considered medically necessary. So it's considered cosmetic under their insurance plan. So that's frustrating because I have to be the bearer of bad news. It feels like, but it's not in my hands. So that part's been hard. And then I think a lot of patients aren't meeting their deductibles because they're so high. So I'm seeing a lot of colleagues again going to direct pay cash practice. That's how my dentist does it. She, we pay her a certain price, and everything we could possibly need is covered under that price with her practice. So I'm seeing a lot of dermatologists do that. So I could see that becoming something in the next couple of years where a lot of us are taking just cash pay. I hope it doesn't ever completely go to that, because there's definitely patients that I love being able to see my Medicare and my Medicaid patients and et cetera. But I could see that
Okay.
being
Yeah.
a turn.
Yeah, I think you hit the nail on the spot where a lot of the different specialties I've talked to are going toward like merging, taking overs by corporate medical groups, and a lot of us don't know what's going to happen with that. So, you touch upon that you work with mid levels such as nurse practitioners and PAs. Can you discuss the changes that you see coming in regard to the responsibilities and whatnot?
Yeah, so I've been following a lot of the kind of like state legislature, at least in terms of Ohio and Florida. And so I think there are a lot of groups, mid-level groups that are trying to get autonomy. And I don't want to go too much into how I feel
Yeah.
about that necessarily, because I work with two NPs, and I think that they're great. I prefer, and I think in medicine it is great to have a physician led care team, and that's how I practice. And I think that's how I would like to continue to see it being done. I think that there is definitely roles that nurse practitioners and physician assistants can play in medicine, but I prefer when it's a collaboration. And so in our office, they're both great. They actually were both there before I came on. I took over for a dermatologist who had been practicing for 30 to 40 years. She trained them just like very similar to how I feel like I was trained in residency, not perhaps with the dermatopathology and surgical, but in terms of like patient hours. So I felt like, mine were trained very, very well, and I supervise them. So we have a really good understanding of what they see, what I see, what's referred to me, complex cases, all the surgeries, et cetera. So I think there's definitely a role for them. I don't necessarily love the idea of some of the legislature going towards complete autonomy. I think that, when you look at the difference between um, MDs and DOs versus some of the mid levels, we have 12 to 16,000 hours if you break it down of like patient contact that we have to have from medical school to residency, and so it's a lot more. And so I think that the way that it is right now, is good. This is how I prefer it, and I hope that it stays this way.
Okay, awesome. Thank you for that answer. And with all these things with corporate medical groups and private equity and all the mid levels, how do you see dermatology in 5 to 10 years with the job market?
So, luckily, I think that there will always be a job market for dermatology, and I think that the reason I know that is because it's so hard to get into a dermatologist. So obviously, there is a need. So I think there's always going to be a market, but yeah, I think with some of the whole goal of some of these hospital groups and private equity buying out some of these smaller private practices is access to care.
Mhm.
So sure, I think that will hopefully make it easier for patients to find a dermatologist, et cetera. But I really don't think that there will ever be a case where it's going to be hard to find a job as a dermatologist. I definitely maybe I don't know how the big cities are, but definitely in the rural areas, they are looking for dermatologists. I get job postings to my email all the time, and there are some of these small towns in Ohio where they've been looking for 4, 5, 6 years. And so I think if you're flexible, you definitely will be able to find a job anywhere in dermatology. But even if not, I think the market should be pretty good. It's definitely not oversaturated. The ACGME, the ABD, the American Board of Dermatology, I think does a good job of, not opening up a lot of different residency programs and kind of oversaturating the market.
Awesome. Thank you for that answer. It's good to know that if you want to go into dermatology, you'll have a job if you're flexible.
Yeah,
Uh,
yeah.
Uh, my other questions are, um, what are some myths regarding dermatology that you think are untrue or unfair?
So, we've already kind of brushed on how it is a lifestyle field.
Mhm.
So it is. But I think that we all hate the myth that we don't work hard. Like a
Yeah.
lot of us will be like, oh, well, you worked really hard to get into dermatology and now your life is easy. And yeah, hour wise, compared to a lot of specialties, we do have great hours, but it is hard work, like from the time that I get there to the time I leave. I don't sit down. I am in room to room, and it's just quick thinking. You're on your feet. Um, and so I don't like the myth that, us dermatologists are out golfing every day and we're not working hard. Um, so I think that's a big one. And then another one is I think a lot of patients think that, or people in general think that all we care about is aesthetics. And again, I know that that's one of the newer fields of dermatology. Not newer, but
Mhm.
it's definitely every month there's a new injectable, there's a new market, a laser. So cosmetics is a big part of what we do, but that's not all we do. Again, I'm doing blistering disorders. I'm doing, transplant medications as immunosuppressants. So it's not just that we're sitting around, injecting Botox and filler, which I love. I love to do that stuff, but it is more complex than, just putting a steroid cream on it and injecting some Botox. So that's probably what I would say.
Awesome. Thank you for that. And then, if students want to learn or about dermatology, if this is a good field for them, what additional resources do you recommend for them?
So yeah, there's a couple things. American Academy of Dermatology, the AAD, has great resources out there. National, there's like eczema, there's eczema foundations or psoriasis foundations. So just to kind of like learn about some of the other topics. But as a medical student, I think the biggest thing you can do for yourself to really advocate for yourself is one, if you have a dermatology department, and you're interested in dermatology, get in with them. Send emails to the program director, send emails to the residents. Don't be annoying, but like get yourself out there and say, hey,
Yeah.
I'm interested in this. I want to hear more about this. If you ever have any research opportunities, just think about me. So I really think you just need to get your name out there
Mhm.
so that you're on people's radars. For the medical students that are at places where they don't have a dermatology department, go out to the community doctors. I've had a couple here that have contacted me because their parents are a patient, et cetera. But talk to us, ask us if there's ways that we can connect you, with different residents. But as a resident, I remember how many projects we would have. And so we loved when medical students wanted to help us out. And there's definitely a lot of opportunity for it. You just need to know how to ask for it and just put yourself out there.
Awesome. Thank you for that tip. And then my last question, and you've given the students a lot of advice and tips, but do you have a top tip that you give to students who are interested in dermatology or?
Yeah, I think it's hard to get into. I
Mhm.
was told that it was hard to get into when I was in medical school, and I know a couple of us were also told that we would probably never find a spot. And so I would say that if you are really interested, just don't give up. Don't take that. You figure out what it is that you need to do, and you figure out how it is that you're going to make yourself stand out. And even if it's a little harder than you expected, like you'll get there. There are definitely ways to find yourself a little niche. I remember talking to my program director when I was in residency, and he said that, when he was interviewing candidates for dermatology, there's a few that he heard of that, never got in, but he was like, they're always the ones that didn't necessarily pursue it to their full extent. And he said the ones that he knew wanted to do dermatology, they all got spots. So, it's hard. Don't get me wrong. It is hard. You need the research, you need the numbers, you need good letters of recommendation. But if it's truly what you want to do, just pursue it and it can be done.
Awesome. Thank you for that. And I appreciate Dr. Mona Mislankar giving your time. I know you're a super busy physician, so I appreciate it.
Yeah. Thanks so much for having me.
All right. Thank you.